107.
God, I hope I didn't erase everything. Okay.
Good?
Mm-hmm.
We're good.
Good.
We are good. Okay, medical terminology. Key terms, combining form,
Where are we?
medical terminology, chapter 4. We're in class Thursday night. Phlebotomy class. Huh?
What am I?
On planet Earth.
Where am I? Who am I? Where is stuff?
How specific would you like us to be?
Okay.
Did you get combining form? Okay, prefix, suffix, and word root.
Only thing you don't need to know is how to make it easier to pronounce.
Exactly. Yeah, pretty much. Everybody figures out to pronounce it their own way anyway. Okay, next page, 108, medical terminology. This will be on your midterm. It is a special vocabulary of scientific and technical terms used in the healthcare professions to speak and write effectively. It is derived from Greek and Latin words. We'll have to name the 4 elements of word building for your midterm, and the first is a word root. The next is a prefix. We don't really have to know too much about them. On page 109, the suffix, which is the end. Has anybody ever taken medical terminology class? Yeah. So, no. If you ever get an opportunity to take one, I would suggest that you do. I know most people don't like this chapter because it's really hard, or I guess it seems really difficult to understand, but really, when you go out in the medical field, it makes it so much easier. It's almost like a second language. If you can somehow pick it up somewhere from another class or whatever and learn it, you will be able to understand things, what people are saying. You can break the words down. Okay, page 110. If you go to table 4.2 as an example, about middle of that prefix column, it says Brady.
It says what now?
Brady.
Wait, what?
Table 4.2.
Oh.
Brady.
Go halfway down, it says Brady. Then it says slow. And the example is bradycardia, which is a slow heart. Cardia meaning heart. And if you think about Brady, I'd always thought, one of my teachers once said, think of the Brady Bunch. When you're toting around, if you're, I don't know if any of you know the Brady Bunch, some of you do.
Yes.
I hope. Yeah, toting around all those kids, it's going to take time. It's going to be slow.
Right.
So that's why I always remember that from years and years ago when I took,
Yeah.
So it's slow. Brady meaning slow. Bradycardia, just a slow heart. Combining vowel, we don't need to know. Combining form.
We do need to know combining form or not?
Was that it? That one? It was one of them. I don't think it was vowel. Was it form? It was a form. Okay. Yeah, it was a form. Word root. A word root is combined with a vowel and is called a combining form. There's lots of different examples in these tables. It just sort of helps explain to you, breaking them down, what they mean. I can't think of any. I don't see any that will be on your test exactly. Well, actually, yes. Go back to 109. Table 4.1. If you go to the second column, the second half, where it says root, meaning an example. If you go halfway down, it says phleb.
Means.
Phleb meaning vein. And the example is phlebotomy. Okay.
And then there's another one. The word root for vessel.
Thank you. Thank you.
On page 114, table 4.6, they have common abbreviations. Like I said on your test, you can abbreviate certain things like hematocrit and hemoglobin, sodium, potassium, things like that, sed rate. This table has a bunch of different words that are abbreviated and made shorter or smaller. The third one down is CSF for cerebral spinal fluid. That'll be on your next, for your final. That'll be one of your words. I mean, CSF is fine. I don't expect you to have to spell out cerebral spinal fluid every time. If you go down towards the bottom, it's ESR/sed rate, or erythrocyte sedimentation rate. I don't expect you to, to fill out erythrocyte sedimentation rate on your test. That's why I say ESR or sed rate is fine. And FUO, it's the fourth one from the bottom, FUO, or fever of unknown origin. Because again, we don't ever say in the medical field, normally we don't say, oh, this patient presents here with a fever of unknown origin. We'll just say FUO, and we know what we're talking about. Okay. There's really not too much. On page 116, abbreviations continue. If you go down, table 4.6, there's STAT, meaning immediately. And that's about it for that chapter. Not really a whole bunch. Any questions? Not too much on this chapter either. That's why we go through 3 of them, because they're pretty small. Chapter 5. First column is body plane.
Wait, I'm sorry, what?
Body plane.
Body plane.
Yeah.
Chapter 5.
Thank you.
Second column is homeostasis. And third is supine or supination.
Oh, I actually was watching Bones.
Bones.
Bones, you know Bones?
The show?
The TV show?
I don't watch much TV.
Yeah,
It's the funny
she actually used supine, and I was like, yeah, I know what that means. Oh, wow.
It's on your
What a
back.
good feeling.
You're really learning something in class, aren't you?
I am. Something actually soaked in.
That's cool.
That's good. Now, did she draw blood? I don't know what Bones is, but did
Bones is you should watch it. It's really pretty neat. She's what's it called? She's an anthropologist,
Forensic
or
anthropologist.
forensic anthropologist, and she helps solve murders.
Oh, that sounds cool.
Yeah, so she deals with the
Interesting.
bones.
Right.
So they call her Bones.
They call her, oh, that's her nickname.
That's
It's
her
Bones.
nickname. Yeah.
I was thinking Scrubs. When I was
Scrubs was pretty damn funny too. Yeah.
But Bones. I've never actually seen the show, but I've heard it's good.
I like this.
Okay, on page 122. Under body positions, other positions, we need to know supine, in which the patient is lying horizontal, on the back, face up. That'll be on your, things that fill in the blank on your test.
Because there's a question.
Supine. The patient is lying horizontal, on the back,
Face up.
face up. And maybe next week too, we can draw laying down, having, take turns somebody laying down, because you don't always draw everybody sitting up. What if somebody says, oh, the last time I had my blood drawn, I fainted. Are you going to have them sitting in your chair? Probably not.
Tied to the wall with tourniquets.
There you go.
Okay. Or you could do something a lot easier and just tell them to lay down.
Okay.
Oh my God.
Wouldn't it be difficult to have them lay down and draw the blood from them?
That was good.
No, it's not difficult. I had to draw a lady today 3 times laying down. We have a really comfortable recliner.
Yeah, golden vein.
No, but she did a 3-hour glucose tolerance test, and so she wasn't feeling too hot. So I made her lay down.
A 3-hour glucose test.
Yeah, so I draw her blood 4 times. So the last 3 times I had to draw her blood, she wasn't feeling good, so I just told her to lay down, and she was fine. So yeah, we'll practice laying down because it's like it's just something different. But it's not bad. Okay. Body plane. Body plane at the bottom, under body plane. It's in bold, is a flat surface resulting from a real or imaginary cut through a body in the normal anatomical position. On page 125 is homeostasis, and that's just the balanced or steady state of the body. Homeostasis, not to be confused with hemostasis, which is something completely different. That's where your medical terminology, medical terminology will come into play. Okay. On page 131 is integumentary system. And we know that integumentary system is just referring to the skin. And under structures, for the midterm, we also need to know that the structures of the integumentary system also include the hair and nails. On page 137 is endocrine system. I don't think we need to know anything for the endocrine system. No, we don't. Sorry, guys. Let's move on to 141 to the digestive system. And we need to know the digestive system, and you can highlight these on the diagram below. It includes the liver, mouth, stomach, and pancreas. The digestive system is the liver, mouth, stomach, and pancreas.
Know the definition, or just know where it's at on the diet?
No, you just need to know that those are the structures that
Purchase
of the digestive system.
Okay.
Includes those things. On page 145 is the urinary system. And the urinary system includes the kidneys, ureters, bladder, and urethra. Kidneys, ureters, bladder, and urethra. The structures of the urinary system
Are the
The kidney, the bladder, urethra, and what?
kidneys, ureters, bladder, and urethra.
I'm only showing you one tip.
On page 149, respiratory tract. And we need to know the structures of the digestive system, liver, stomach, mouth, pancreas. Oh, I'm sorry. That was a note. Okay, respiratory tract is pharynx, larynx, trachea, bronchi, and lungs.
It was actually on Jeopardy last night.
It was?
Pharynx and larynx.
Pharynx and larynx.
Pharynx, larynx, trachea, bronchi, and lungs.
Yeah.
And the lady was a pediatrician. She got it wrong.
Oh, really?
That's
Wow, no kidding.
Unless she was like really nervous,
Maybe.
because she should know that. Yeah. No. Okay, circulatory system.
What page are you on? Oh, never mind.
The next page.
2 pages actually.
Okay, 2 pages actually. All right. And the first column is basilic vein, coagulation, and cross-match. And the next column is erythrocyte, hemostasis, leukocyte, median cubital vein, pulmonary circulation. And the third column is rhombocyte and ventricles. On the next page, 154, under the heart structure, we need to know the layers of the heart, the epicardium, endocardium, and myocardium. And you'll have to list those on your test.
Does it have to be in order? Is it-
No.
So this is going to be on our midterm.
Yep, sure is.
How many questions do you have on the midterm?
Too many.
154.
On the mid.
on the midterm.
Yeah, it's worth 286 points.
That's right.
You'll be okay. On page 159. At the bottom where it says blood pressure, in bold it says sphygmomanometer. That's what the blood pressure cuff is called, is sphygmomanometer.
That's the most easiest one.
Yeah. I don't know of a smaller abbreviation for that word, but that's referring to the blood pressure cuff.
SG.
Isn't the stethoscope sphygmometer?
No, the what?
Stethoscope.
It's just a stethoscope. The blood pressure cuff is a sphygmomanometer.
No, I know. Oh.
What? Oh. I saw you looking. I'm like, oh, is there something you want to say? Are you sure? Okay, 161. We'll need to know the 3 types of blood vessels. The arteries. Arteries are blood vessels that carry blood away from the heart. Underneath the second key point, talks about the arterioles, are the smallest branches of arteries that join with the capillaries. Arterioles are the small branches of arteries. Okay. Veins. Veins are blood vessels that return blood to the heart, and they carry blood that is low in oxygen.
Those are the 3 types of blood vessels?
What? Yeah. Three types: arteries, veins, and capillaries. We also need to know about the arterioles, which are the smaller branches of arteries. Then there's veins. Now, veins, since the blood is deoxygenated, means that there's not so much oxygen going through the veins. So when we draw blood, the blood looks really dark. Now, when you draw blood from an artery, because there's a lot more oxygen going through the arteries, it's brighter red. It's like your Kool-Aid or whatever you're drinking. It's red like that. Yeah. Okay. On the next page, the smallest veins at the junction of the capillaries are venules. The smallest veins at the junction of the capillaries are called venules. And then capillaries. And capillaries are microscopic, one-cell thick vessels that connect arterioles and venules. And that will be on your test. I believe it's a true and false question. Capillaries are microscopic, one-cell thick vessels that connect the arterioles and venules.
Yeah, it's a true. It's a true statement because it's right here in the sentence.
On 164, lumen. Lumen is the internal space of a blood vessel through which the blood flows. It's also the diameter part of our needle. That hollow space is also referred to as the lumen. On 166 is the antecubital fossa, and that's just the center part of our arm here. So you'll have to write antecubital fossa on your test.
In front of the elbow.
Huh?
It's in the front of the elbow.
Yeah. It's the area right in front of the elbow. On page 167, it talks about different types of veins, H-shaped antecubital veins. I don't have any antecubital veins, but some people have really big ones. They look at it shaped like an H or a W or some or whatever. So, H-shaped veins. This is the order that in which we would choose our veins in which to draw. The first we would go for is the median cubital vein, which is the one we've been drawing from, the center one, median cubital vein. The cephalic vein is the vein on the outside of the arm, on the outer side of the arm. Okay, and the basilic vein is the one on the inside of the arm, which would be our third choice, because the artery lies right underneath that, and there's a chance you could go through the vein, hit the artery, and get arterial blood. And there are some tests that cannot be ran on arterial blood, just because of the components are different in arterial blood and in venous blood. So that is our third choice. On 168, it tells you about M-shaped antecubital veins, and it's still the same as far as choices: median cubital, and they say median cephalic, and median basilic, but it's still the same order. On 169, leg, ankle, and foot veins. We are not allowed to draw from the leg, ankle, or foot without a doctor's order. Okay, that'll be on our midterm. And arteries. Arteries are not used for routine blood collection. They have different lab values, like I said, than venous blood.
Oh, but what do we highlight? I know arteries, but just,
Arteries are not used for routine blood collection.
okay, that's it.
Yeah. They use arterial blood for blood gases. Have you ever heard of like arterial blood gases?
No.
Yeah.
What is,
Check your oxygen.
It checks your oxygen levels.
oh.
So yeah, that's what arterial blood is used for primarily. If you do happen to get arterial blood, say, I mean, still send it. I mean, you never know. I mean, I don't know specifically what tests it would affect or have negative effects on, and sometimes you get a mix of arterial and venous blood, so you may not even know if, for sure. But that's why it's always best not to go for that basilic vein. On page 170, blood composition. Under blood composition, second to the last sentence, 55% is plasma, 45% is formed elements. Blood composition, and that's normal composition of blood. 55% is plasma and 45% is everything else, formed elements. If you're going to be drawing, when you draw your patient, you want to make sure that, I mean, the other reason why we like to feel for our veins, and maybe you feel a vein that is not the best vein, but you're going to go for it because that might be your only option. So you might have to use a smaller tube. If you instead use a big tube and you don't fill it up, depending on what the test is, you may not have enough serum for them to complete the testing off of this. But if you were to get a smaller volume tube, sometimes the vacuum in these big tubes is too much for certain types of veins. It will just collapse the vein, just suck it completely shut, tight, and then you're not going to get nothing out of it. Where this is better is because there's not as much vacuum because it's a smaller volume. So it may not have that same reaction. But my point is that whichever you choose, you want to make sure that you fill these until they're done, until they're completely full. Because depending on how many tests or what test is drawn, like when you do a panel, a comprehensive metabolic panel or a basic metabolic panel, where there's a multitude of tests in that panel, you're going to need at least a couple of mils of serum. So if you only get a quarter of this tube full of blood, you're not going to have enough serum to run those tests. I mean, if you only get a quarter amount of serum and you're only going to run, say, a sodium, you'd probably be okay. But that's why you want to use something smaller so it's full. To have a little bit of extra is better than to have not enough, because you have to call your patient back, go back and stick your patient a second or third time. They're not going to be very happy. Okay? And then, of course, that just delays all the results and the diagnosing of the patient to the doctor. Okay, 171, plasma. Plasma. Normal plasma is clear, pale yellow fluid. We don't have to know the composition of plasma. Formed elements. We'll start with erythrocytes, or red blood cells, RBCs. Erythrocytes, that'll be on your midterm. Also in the key point, the main component of RBCs is hemoglobin, and that hemoglobin gives the RBCs their red color. Well, that will be on your midterm. And that paragraph right underneath the key point, 6th sentence down, it says, talks about RBCs, and they are described as an anuclear biconcave disc, and that will be on your midterm. Just kind of defining what it is. RBC is described as an anuclear biconcave disc. The next is leukocytes, or white blood cells. And that will be on your test. On page 173, we must know 3 out of the 5 types of white blood cell count, or white blood cells. Table 6.5, types of normal white blood cells. There's neutrophils, eosinophils, basophils, monocytes, and lymphocytes. So I have to name 3 of those. And destroys, and also if you go up to the top where it says neutrophils, destroys pathogens by phagocytosis. Actually, you need to put, I know we talked about this earlier and we're going kind of reviewing for the midterm. So do not write white blood cell or WBC, it's neutrophil. Because it's a type of white blood cell. And that one's specific to this phagocytosis, destroying pathogens. Does that make sense?
So lost. I don't know. Which one?
Okay, neutrophils. You see neutrophils?
Yeah.
Okay, if you go over to where it says function,
Mm-hmm.
it says destroys pathogens by phagocytosis.
Yeah.
Neutrophils does that.
Okay.
And neutrophil is a type of white blood cell.
Okay.
So don't just say white blood cell.
Okay.
It has to be specific. With
Yeah, for this it does.
Okay.
Because that's what it's going to say on the test.
Okay.
So,
Thank you.
you're welcome. On page 174 is thrombocytes, and thrombocytes are also known as platelets. And the second to the last sentence of that paragraph says they are the first cell on the scene when an injury occurs. Platelets. Blood type. If you go down to the 6 sentences down on blood type, if a person receives a blood transfusion of the wrong type, the antibodies may react with a donor RBCs and cause them to agglutinate, meaning clump, or lyse, meaning hemolyze, or disintegrate. Such an adverse reaction between donor cells and a recipient can be fatal. So, by giving somebody the wrong type of blood, the worst thing that could happen is they could die. That's not good. Under ABO blood group, the 5th sentence down, type O is the most common and AB is the least common. That you'll have to know.
AB, like what does AB stand for? Pretending.
That's the way they label the types. Okay, page 175. Blood specimens, serum. Blood that has been removed from the body will coagulate or clot within 30 to 60 minutes. The remaining fluid portion is called serum and can be separated from the clot by centrifuging. Serum has the same composition as plasma, except it does not contain fibrinogen. So only plasma contains fibrinogen.
I'm sorry, but can you tell us exactly what to highlight again?
Yes.
I'm sorry, I wasn't.
That's okay.
Sorry.
Nope, you're fine.
Serum.
It's explaining what serum is. Blood that's been removed from the body and will clot within 30 to 60 minutes. Okay. The remaining fluid portion is called serum. It can be separated from the clot by centrifugation. Serum has the same composition as plasma, except it does not contain fibrinogen. Only plasma contains fibrinogen, which aids in the formation of the clot.
Thank you.
You're welcome. Now on page 176, there's a purple tube. And this purple tube, does the purple tube make plasma or does it make serum? Yes. So if we were to spin down a purple top tube, what they call is the thin layer between the plasma and the red blood cells is a buffy coat. Okay? And the buffy coat consists of white blood cells and platelets. So you'll have to know that. The buffy coat consists of white blood cells, WBCs, and platelets. If you spin down an SST tube, you're not going to see a buffy coat because there isn't one. Okay, under plasma, if you go down to the ninth sentence down, at the end it says blood can be prevented from clotting by adding a substance called an anticoagulant. Can you name an anticoagulant?
Heparin.
Yes. Good job. Any others?
EDTA.
Yep. Any others? That's it? Heparin, EDTA?
Sodium citrate.
Yes. I was thinking that exactly because your shirt was light blue.
My shirt. Wait, what?
Your shirt. Any others? Hmm?
Is it a problem?
ACD anticoagulant?
Sure is. What about the gray two?
Sodium chloride.
For-
Sodium chloride and potassium.
Oxalate.
Yep, very good. Those are all anticoagulants and they keep the blood from clotting. Okay? Okay. Second to last sentence down on that paragraph says the major difference between plasma and serum is that plasma contains fibrinogen. Plasma contains fibrinogen. That will be on your test. Whole blood. Some tests, including most hematology and some chemistry tests, such as a glycohemoglobin, cannot be performed on serum or plasma. These tests must be performed on whole blood, blood as it is that is in our body. On page 177, box 6.4, examples of blood disorders and diagnostic tests. We must know 2 blood disorders: anemia, leukemia, lymphocytosis, leukopenia, polycythemia, thrombocytosis, thrombocytopenia. Any of those, just know 2
Just
of
know
them. Whichever 2 is easy for you. Hemostasis and coagulation. Hemostasis means the arrest or stoppage of bleeding. It is the body's response that stops the loss of blood after injury without affecting the flow of blood within the rest of the vascular system. Hemostasis. On page 178, it explains to you the hemostatic process. You don't have to know that for the test, but if it's interesting to you, you can read it later.
Memorized all the factors for nothing.
Huh?
Memorized all the factors for nothing.
What factors?
All the factors here. Gave the 6, 7 factors for blood coagulation.
You memorized all those?
Yeah, didn't everybody?
No.
Oh, well.
You're going to be really, really experienced on these. I don't even know what half of these say, these numbers anyway. I mean, some of these we use, but these are tests that are done on people that can't clot, their blood doesn't clot. So, I mean, or,
Like for the
or if they
people
do
that-
clot,
For the people
Too
that
much.
like bleed.
have clotting issues. these are the types of tests they do on them. I think that's about it. Oh, the lymphatic system on page 184. Almost there. The lymphatic system at the bottom. At the bottom. It returns tissue fluid to the bloodstream, protects the body by removing microorganisms and impurities, processes lymphocytes, and delivers fats absorbed from the small intestine to the bloodstream. The lymphatic system. And that is it. Any questions?
This is gonna be staying over, so anybody text me.
That is why I urge you to get together somehow, either in person or by Skype or whatever.
Let's put it this way, I'll be studying at home. If anybody wants to join me, that's fine.
There you go.
Get your little groups. You mean you can make more than one group. You'll have an hour and a half to complete your test next week.
An hour and a half.
It's gonna be multiple choice.
There's multiple choice, matching, fill in the blank. That's it. There's no essay. A lot of it is on, there's a lot of questions that are fill-ins on your consents. So know your consents. Anything you want to go over?
Did you take down my phone number?
No.
It's 702-280-2386. And if I don't get it back to you, like at least by Saturday, call me.
Okay.
Because that means I will have lost this.
Okay.
Okay. Okay. Did you take down my number?
It's Patty.
Yes.
Oh, there.
Oh, hi. I'm just like,
702?
Does midterm focus a lot on the laws? Like CRM,
The torts. oh no. Did you,
I don't think that's laws. It's law.
280.
are you talking about the torts? Like, the assault, battery, invasion of privacy?
Dolores. T-O-L-O.
What laws? I guess I'm confused.
I'm sorry, everything in chapter 1 starts, like all of like PLSI and...
Oh, those.
It's like, I'm sorry, I'm tired.
I can tell
I
you.
want to lay down right now.
I gotta go home and catch up on my Grey's Anatomy.
It is so easy to watch that show now. I don't have to think about
wait
now.
until
Like,
after.
oh.
Watching the whole season. This is going to be a cram session. This is going to be hardcore stuff. So, if you want to meet like 6 o'clock, or 6 o'clock.
On Saturday?
Saturday.
Okay.
Just another reminder. Another reminder.
Okay.
Guys.
My mom will definitely...
Reminder. You have to pass the midterm with an 85% or better next week.
So how many can we miss?
None. Zero. Don't miss any.
You need to pass with an 85.
85% or better.
And when are we gonna have our grades for that?
Okay,
'Cause
so
I'll
I.
probably be nervous, stomach, like,
I'm gonna have a nervous stomach because I have to go on vacation and fly the next day and I don't have to fly. So I'll probably go home and just grade your tests and I will email you by Friday because there'll be no other chance for me to email
If we
you.
don't pass.
I'll be calling you on Friday. So you better pass. Don't ruin my vacation, please. I want you all to pass, and I know you will. You get 85% or better. You just need to study. Study your midterm review. Study everything we've gone through and highlighted. The questions, the little quizzes, things like that we've gone through. If you are confused or need help, you can email me, but I'm not taking my book with me.
Right.
So you can email me and I'll do what I can for you.
We'll send you a page.
We'll send it to you in the email.
Okay, take a picture and send me a page of the book or your question or
You're not going
whatever.
on vacation until after the midterm, right?
Right, I'm leaving Friday. Next Friday.
Oh, okay.
Just Friday?
Next Friday. Not tomorrow, but week.
Just on the off chance that you don't pass. We're out of the class, right?
Right. If I have to call you and tell you did not pass the midterm, it's going to ruin both of
Yes.
your weekend and my vacation.
So if we get a call, that means we can, like,
It won't be good. It won't
We
be
can
because I'm
ignore
saying, woohoo, you got a 99% or whatever. No, it will be
That's the kind
because
of call I would love to get.
yeah.
Seriously.
I know the answer if you call.
I don't even